Namaste everyone. Welcome to yet another session in the ongoing Yes Talk series. Today we have with us Dr. Smriti. She's an MD in Pediatrics and is on the faculty of Department of Pediatrics at the ESI Postgraduate Institute of Medical Sciences, New Delhi. She has a special interest in nutrition and child growth, and the same line she'll be talking to us about myths and facts about common childhood problems. So thank you, Dr. Smriti, for accepting our invitation, and over to you.
Good evening, everyone. Namaste. Can I share my screen? Am I audible?
Yes.
And my slides are visible?
Yes, it's visible.
Good evening. I'm Dr. Smriti, a pediatrician by profession, and today I'll be discussing about myths and facts about common childhood problems. Before discussing about the problems, I would like to describe what is a normal child, which is very beautifully described by Sri Aurobindo in the words that child is a soul with a being, a nature and capacities of his own, who helped to find them, to find himself, to grow into the maturity, into fullness of physical and vital energy, and the utmost breadth, depth, and height of his emotional, his intellectual, and his spiritual being. So each child is a very different and pure soul with his own unique abilities and capacities. And as parents, it's our responsibility to nurture them so that they manifest these qualities to grow into their best forms. So now coming to the topic of today's discussion, the most common childhood issue is related to feeding, as most of the parents feel that my child is not eating enough. And by eating enough, they mostly mean in quantity. Whereas if you ask them, they'll mostly describe in terms of they're not eating proper meals like dal, chawal, roti, sabzi. And otherwise, they're good to indulge in biscuits or chips, kurkure in between. So, as parents, we have to explain them the importance of the food, which is the purpose of food is nourishment. And we have to find a balance between taste and nourishment. But during this process, we have to keep in mind that we cannot force feed them. So that if we do that force feeding, it destroys the normal hunger instinct of a child. Here, I would like to explain in a way that when the child is very young, like around from newborn to 6 months of age, generally the hunger instinct is there. The child cries for milk. But as the child grows, the most common complaints of the parents become that the child is not asking for food. So we have to see that we nurture that instinct for food. We do not destroy by force feeding them. And at times we also force them to eat what they find it's very distasteful. So we have to be very gentle, and it has to be a gradual process of introducing these foods to them. Also, the common problem is they face that what to eat, what to give children to eat, how and when to eat. So the most simple question for what to eat is that the whole family has to eat what you want the child to eat. And also involving the child in the process, that either they help the mothers in cooking a little bit, or maybe laying the table or serving That also improves the child's relationship with the food and also their appetite. And it's also a good idea to have a routine, like we have a fixed time for the breakfast, lunch, dinner, or some snacks, and the whole family eats together. Like if we have a dinner routine or a lunch routine, so sitting together as a family, washing hand before, then maybe praying for a minute or two before eating, and then eating together. So all this really helps the child in building an appetite, in building a positive relationship with the food. And it's also important that the child eats with their own hand as soon as around 12 to 15 months. We don't develop that habit of feeding the child always. So, as we all know, food tastes better when it's eaten together with the whole family. So when I'm describing about food and nutrition, the other important question which comes into the minds of parents or what they feel is that milk is a very important part of the food item. So yes, I also believe that milk is very important, but that importance is in the first 6 months of life, especially breastfeeding. And if excess of milk is given after that, it may result in decreased preference for other foods, which might be detrimental for the growth of the child. Because once the child is beyond 6 months, he needs more nutrition to grow. He needs more in terms of calories, proteins, and other things. So it is a better idea to expose the child to diversity of food groups. Here I have described about various food groups. So in our culture, we already like we try to give a balanced diet. By balanced diet, I mean we try to give two food groups together, which are complementary to each other. For example, once the child is 6 or 7 months, we introduce khichdi so that the grains and the pulses cereals are growing together so that they are complementary in nutrition to each other. And here I would also like to explain the importance of giving different colors of fruits and vegetables in the plate of the child so that the child is not only getting I would say protein, calories, or in terms of fat, but is also getting other vitamins, minerals, and other nutrients which are equally important for the growth of the child. For example, I would say like red and yellow fruits like carrot, beetroot, mangoes. These are very good for the skin, for the eyes of the child. And something like green colored vegetables and fruits are good for detoxification, for building immunity of the child. So again, I would like to express that diversity of food groups should be introduced to the child from the very early age, and at least one animal source food and one fruit or vegetable per day should be given to the child along with the staple food. So, when we are talking about food, we must talk about the popularity of junk foods today, especially among children and adolescents. Also, because of their easy availability and a lot of advertisements done by the famous stars. So, it's become very popular among the adolescent groups. And by junk food, we mean those foods which are not nutritionally appropriate. And there's a very common acronym which describes the junk foods, which includes ultra processed foods, nutritionally inappropriate food, caffeinated beverages, and sugar and sweetened beverages. So, to find a balance, at times it's very difficult for the parents. So, they find a middle path and they feel that maybe introducing or giving milkshakes and juices from the fast food centers are a little healthier options rather than giving other foods. But the fact is that even these juices and shakes are full of sugar and they should be avoided as far as possible. They have a lot of additives, preservatives, coloring agents, and a lot of agencies are working on it to make it more palatable and addictive for children. So it is best to avoid them. And even if we are giving it, we should not be given it more than once a week. All these ultra processed foods increase the risk of allergies, cancer, and dental caries. And also, they have been seen to cause psychiatric and sleep disturbances in children. So, a better alternative for the children is to offer them a traditional and acceptable homemade snacks, like we all have. Some have chakli, matri. All these types are better options to give to children rather than giving food from packet foods, food from fast food centers. This is also very beautifully explained by Sri Aurobindo in the words that if the child from the very beginning of his existence learns good habits, it will save him a good deal of trouble and inconvenience for the rest of his life. And we as parents can play a major role in developing these good habits. Coming to the next common issue, which is also related to a part of nutrition, that most of the parents feel that the weight of my child is less. And mostly it's because they compare it to other siblings or other children whose weight may be more, and they feel that overweight children are healthy. However, the fact is, the overweight children are also malnourished. By malnourishment, I mean they are nutritionally deprived of a lot of nutrients, and there's also far more incidence of anemia in these children than in normal weight children. This is because of the fact that these obese and overweight children have a chronic inflammation. So the absorption of the nutrients is very poor in their body. And these children, due to obesity, overweight, poor eating habits, sedentary lifestyle, they are also prone to lifestyle diseases in future, like hypertension, cardiovascular disease, and diabetes, etc. So it's important to know what are the early predictors of childhood obesity. And it starts actually from the time of conception. So it begins with health of the mother, that is maternal obesity, excessive weight gain in pregnancy, or even early introduction of formula feeding. So I would again like to explain that breastfeeding can really help the child and cut the chances of child becoming obese by up to 25%. So now if I'm talking about nutrition and food, one of the very common practice we have observed is that the child is being fed while watching screen. It is shown to the child to distract him while the mother is putting food in the mouth of the child. It's a very common scenario. And parents feel the myth is that the child is getting at least enough calories, proteins, or other nutrients. But have you ever thought that whatever the child is getting with the nutrients, the child is also absorbing a lot of emotions, like scenes of fighting, betraying, sad news. If he's watching on the screen, he's also absorbing those negative emotions. And if we think about it very differently, if we see that if we are ever angry or if we are afraid, will our body be ready to absorb the nutrients, what is going in our body? So it's a very questionable matter that if we are eating while we are angry and fighting, the body will not be able to absorb what the nutrients are going inside the body. So it's not a good idea to practice this. And also the child does not develop a relationship with the food, and he does not realize the importance of eating. So it's just a mere task that he's watching a screen and the mother is putting food into his mouth. So this practice is not good for his health and for his growth both. And if I'm talking about screen, there are also a lot of questions about the screen timing. And parents have a myth that screen time limits is only for the children. So they can use this screen time for their own convenience and also use this smartphone as babysitters whenever they want. And if they are not happy, so they restrict the child then. So first we have to set an example for the children and not use these mobiles, TV, etc., while interaction with the child. And as far as screen timing is concerned, for children less than 2 years, the child should not be exposed to any type of screen. Occasionally, a video call with the relatives may be allowed, but however, they should not be exposed to screen. And children beyond 2 years up to 5 years should not watch screen for more than 1 hour. However, it is better if it is lesser. We should always try to strike a balance between the screen time with other healthy activities in older children, like reading, maybe physical activities, because a lot of ill effects are there of excessive screen time, both on the physical and the mental health of the child. It also becomes an addiction for the child if the child is exposed to a lot of screen time. So, in this era of widely prevalent social media, it is very difficult to keep the adolescents away from these social media. So, a lot of people ask, what is the ideal age when their children can be exposed to these social media like WhatsApp, Facebook, which is very common these days. So, it is best to be avoided in pre-adolescent and early adolescent age group. By this, I mean up to 12 years. The pre-adolescent is 7 to 9, and early adolescent qualifies for 9 to 12 years. And for children of 13 years or more, they can be allowed only under parental supervision. And if only the parents feel confident that their child is mature enough to handle it, then only they should be allowed to use these social media platforms. Now, I would like to talk about a little different issue, which is regarding a parental anxiety during illness or fever of the child. And the parents have a myth that fever is bad for my child, it's harmful. However, the fact is that fever is a protective mechanism of the body against any type of infection. And the main purpose of these antipyretics, which are crocin, paracetamol, which is easily available over the counter, is not to bring the fever to normal, but only decrease it by a few degrees so that in that time the child is a little normal, can do his normal activity, eat a little, and make him a little comfortable. But we have seen as pediatricians, by day 3, day 4 of fever, parents get quite worried and they keep going to the pharmacist or doctors. And by the time they come to the doctors, they've already taken 1 or 2 antibiotics in India because they are very easily available over the counter. So here I would like to explain that most of the infections in children, especially less than 5 years of age, are viral in origin, which does not require antibiotics. They can be cured by the own child immunity. So we should shift the consciousness from that of worry to faith in the child's healing power, his immunity, and his capability to fight these infections. There are very few serious conditions in which children require antibiotics from the very beginning. And it is always a better idea to seek some medical advice before starting antibiotics instead of taking it from the pharmacist. So here I would like to share some lines from Sri Aurobindo, which very beautifully explains this, that you must not fear. Most of your troubles come from fear. In fact, the percent of illness are the result of the subconscious fear of, of the body. In the ordinary consciousness of the body, there's more or less hidden anxiety about the consequences of the slightest physical disturbance. So the more you think of it, the more you concentrate upon it, and above all, the more you fear, and the more you give a chance for the thing to grow. If, on the contrary, you turn your attention and your interest elsewhere, you increase the possibilities of cure. By this, I would like to explain that even when the child is sick, the 90-95% of the child's health is still working properly, and we should concentrate on that 90 to 95% of child's health rather than thinking about, worrying about that 5% which is sick and weak, so that child gets a immunity boost and it helps the child to heal faster. So coming to almost the end now, which I would like to share another common question or the myth is that should the child be allowed free play? And most of the educated and ambitious parents always think that my child is not learning enough if he's doing free play. But it is not actually the fact. Free play actually allows the children to use their imagination and be more creative. And it also gives a chance to the parents to know about the instincts, the aptitude of their child, so that the child grows in his own best form. However, if the child engages in inappropriate actions, the child, it should not be ignored, and it should gently but firmly be redirected to a more appropriate action. And discussing more about the play, it's very important for the parents to be involved with the child during play. However, they should refrain from giving too many instructions because parents feel that we should ask questions or test their knowledge while playing so that they are directed to learn something. But all these activities also can put off the children. So it is a better idea to allow them to have a free play. However, after a certain age, maybe 3 or 4 years, you can have some time of structured play also along with free play. So to conclude, I would use the line of mother that to speak good words and to give wise advice to a child has very little effect if one does not oneself give him an example of what one teaches. So it says that we have to be a good role model in order to teach something to our children. Thank you. Any questions anybody would like to ask?
You may stop sharing the screen now.
Yes.
Hello.
Hello. Yes.
One of the problem you touched briefly was about the childhood obesity.
Yes, sir.
This is a problem. It's a growing problem. It looks like, and as you mentioned, it has got repercussions in the later life.
Yes.
So, can you throw some more light as to how to alert people towards or what they can do to control this tendency towards obesity from childhood?
Yes, sir, sure. So I would like to say that, as I've mentioned, that risk factor for obesity, it starts from the very time of conception of the mother. So the health of the mother during pregnancy, excessive weight gain is a risk factor. Then, as the child is born, uh, breastfeeding helps in preventing obesity later. Then, as the child grows, we have to have healthy eating habits, sleeping habits. By sleeping habits, I mean sleeping on time, not uh, I would like to say in the terms of uh, proper nutrition. As I've touched that a lot of food fads and junk food eating is also commonly prevalent these days. So all these also lead to obesity. And if the child is not sleeping properly, if the child is not having proper physical exercise routine, all these habits are a risk factor for development of obesity.
Thank you.
Any other question?
No, there are no questions in the chat box. So,
hello, I have a question, if that's okay. So, hi, I'm Leanne, and thank you for a great talk so far. I was just wondering, do you have any advice on bottle refusals in babies when they are refusing the bottle? And how would you manage that, especially with poor weight gain?
I'm sorry, I didn't get your question. Your voice was breaking. Can you repeat?
So in terms of child nutrition, sometimes babies are given top-up formula. Now, do you have any advice when families are trying to give top-up but the baby refuses the bottle?
Yes. So sometimes when the child is young, like between 1 to 6 months, there's a tendency towards giving formula because mothers feel that the child, their breast milk is not enough, or the requirement of the child is more, or sometimes the mothers are very tired and they want to rest and they end up giving 1 or 2 top feed at night. Mm-hmm. So here I would like to say that formula feeding, they have a lot of they are generally formula feeding is given by bottle, which is a passive form of feeding, and breastfeeding is an active form of feeding where the child has to put in a lot of effort for breastfeeding. So generally kids tend to overfeed when they are given formula feeding. One, they are a little sweeter. Two, they are fed by bottle. So it's a very easy passive method of feeding where the milk is just dripping from the bottle and the child is just suckling. So these are the 2 factors when the child tends to overfeed also. So the child, one, that the child tends to overfeed, they throw up, they have vomiting. Secondly, there's also risk of infection when we are introducing formula feed by bottle. thirdly, there's also lead to nipple confusion when we say that the child, we are feeding the child with a bottle nipple, which is a passive feeding where the milk is just dripping. And then at times we are giving breastfeeding, which is an active process where the child has to put in a lot of effort to extract milk. So it leads to confusion in the child, and slowly the child starts refusing breast milk here because obviously he chooses the easier way, and he prefers the easier way where the milk is just dripping. So one or two feeds we feel that it may not harm the child, but slowly the child gets used to that bottle feeding, and then it leads to nipple confusion, and the child starts refusing breastfeed also. So in the long run, it is not a good idea to do that.
Thank you. I was just wondering if they are refusing both breast and bottle, if you have any advice.
If they're refusing both breast and bottle.
Yes.
So you mean to say they want to drink by
they don't want to drink at all?
Maybe a spoon or a cup? No. So if they are refusing all type of milk, I would say, and if the child is really young, so it depends on what age you are talking about. So if the child is really young, like less than 6 months, we must go to a doctor and seek medical advice if the child is refusing all type of milk. However, if the child is old enough, like maybe 1.5 year, 1 year, where the child is not accepting breast milk too much and is also not taking formula feed, we can give other types of food. That is what I'm trying to say, that we don't have to stress on too much of milk. We can give other types of complementary feeding foods, like we introduce like khichdi, dal, chawal, grains, whatever is the cultural food, the family food can be introduced to the child.
Okay, thank you very much.
Thank you. Yes.
If there are no other questions, I thought I'll wind it up.
Yes, sir.
One of the most important take-home messages from today's talk was that we should trust the wisdom of the body, whether it is eating or whether it is fever. In either case, and in many other cases, as you pointed out, we should trust the wisdom of the body. The body has an instinct for how much to eat, and if we do not interfere too much, the child knows when to eat and how much. And in the same way, if the child has an infection, then we should not worry about the fever, so long as the fever doesn't go so high as to threaten the child. And usually, I think the cutoff is 102, isn't it? If it goes beyond 102, then generally we do use an antipyretic, but then again, not necessarily to bring it back to normal, but to bring it down by a few degrees, as you said, so that the fever itself does not become something which is dangerous for the child. Because all metabolic reactions work better at a higher temperature, and so do the mechanisms of healing. So we have to have faith in the wisdom of the body, trust it, and not interfere too much with it. When it comes to eating, I was thinking of what one of my teachers, Dr. Meherban Singh, who may be around 90 now, used to say that pediatricians eat because children don't. That is the commonest complaint with which mothers come. And that happens again because we feel over concerned with how much the child should be eating. If we don't force the child, of course, there should be love and affection, but that doesn't mean that all the love and affection has to be expressed by trying to feed the child as much as possible. And if we leave the child on its own, the child knows how much to eat. And in fact, some of this interference starts very early because in breastfeeding itself, there are two schools of thought. I don't know how much that is true because I'm an old timer. That one is scheduled feeding and the other is on-demand feeding. Now, out of the two, on-demand feeding is probably better because scheduled feeding means that somehow the textbook says that a newborn should get breast milk every 3 hours. So by the clock, every 3 hours, we put the child to the breast and expect that the child will start suckling. Now, that is where the interference begins. We can wait a little for the child to actually feel hungry. And so starting with that, and then as the child grows up more, then, we go to other extremes of trying to distract the child using the smartphone, or even while the child is playing, we start running after the child so that where the child stops, we are ready with a spoon and some food in a plate and put some in its mouth. Now, that is the sort of things which lead to problems. And then we complain that the child has become overweight. Of course, overweight doesn't mean healthy. Childhood obesity is becoming a major problem, as Dr. Hrishikesh Acharya just mentioned. And when it comes to this childhood obesity, there are a few things which are important. One is, of course, right eating habits. The other is we ourselves sometimes generate in the child a feeling, an impression that food itself is a source of great pleasure. If the child is not eating healthy food, okay, if you don't want this, then you can have some dessert. So, we feel as if dessert is tastes good and you can use it as a source of pleasure. And even if you have that, at least you are having something. So we are inculcating that. And instead of increasing the preoccupation with food, what we should be instead of that doing is also bringing into the child's routine physical activity so that the child feels that not only eating but physical activity is important and other creative activities. So that the preoccupation with food goes. This is something which actually continues lifelong. And Sri Aurobindo and the mother have said somewhere that one of the biggest problems with human beings is that they seem to be rather too preoccupied with food. So this preoccupation with food is itself something which leads to childhood obesity, coupled with reduced physical activity, and that's becoming more and more again because of the various types of small screens available. So these are some of the things. And then, another way we spoil the child is that we, for our own convenience, sometimes start giving the child a smartphone, as you said, as a babysitter. So we use the smartphone as a babysitter. We use the smartphone as an aid to feeding the child more. And then we complain that the child is spending too much time on the screen. The child is putting on weight. The child is not eating well, and so on and so forth. So basically, the parents have to correct the way they bring up the child and also correct their own behavior. If they are seen using the smartphone too much, looking at the small screen while eating, then the child picks up that habit just by imitation. Because where the child is concerned, whatever the parents do is the right thing to do. And if we have set the right example and give the child the right type of preoccupations, a wider variety of preoccupations, much wider than just food, and that is what will solve probably much of the problems. Thank you, Smriti, for bringing out some very important points in today's session. And if there are still some afterthoughts somebody has, we have time. Otherwise, I'll request Aditi to wind it up and announce the next Saturday's session.
Thank you so much.
Sure. All right, then we just come to the end of today's session. Thank you, Dr. Smriti, for spending time with us. And next Saturday, we'll be having with us another guest, Ms. Janvi. She's a budding psychologist, and she will be in conversation with Dr. Bichlani about an inspiring career in the field of psychology and how studying in India and abroad in the field makes a difference. So that will be our next Saturday. So today we can just end with a few seconds of silence. And once again, thank you everyone for joining.